You are not at the finish line yet. Goal Setting as We Age by Kate Harmening, Hunter Dittis, Alec Hebner, and Jessica Cox.
As the years have gone by, historically, humans are living longer than we used to, and as the risk of developing chronic health problems increases with age, the number of people living with chronic illness is increasing. Due to this issue, professionals have been trying to engage more with the elderly and having them create goals for themselves to see if that affects their performance. Examples of goals that elders can try to obtain would be learning to play a song on the piano or even something as simple as making your bed in the morning or reading a book. Some chronic illnesses that elders are at risk of are arthritis, dementia, depression, anxiety, etc. Some elders who are in nursing homes are dealing with chronic disorders and are limited in what they are able to do. There are elders who are limited to eating, ambulation, and health management. When it comes to ambulation, some goals that these individuals can create would be sitting balance, standing balance, walking on ground level, and then walking up and down stairs. Some findings show that goals are met faster if the elders are in charge of what they are going to achieve. In class, we talked about how we need to let the elders be individuals and should not treat them the same way we would treat children. Elders do not want to listen when they are being talked down to. In this study, the effects of mutual goal setting practiced in older adults with chronic illness, there were 66 subjects, and as a whole, they were split into two groups. Each person had to be over the age of 65 and had to have at least one chronic disability. Oral and written instructions and information was given, and then the participants were given goal tasks. Throughout the study, there were nurses and workers that worked with the elders and helped them obtain goals, while the experimental group used strategies to help reach their goals. Overall, it showed that those who positively moved towards their goal in a systematic way helped them reach their goal quicker. According to Roth and Latham, the process of setting goals facilitates behavior change by guiding individuals' attention and efforts and increasing persistence towards obtaining a specified level of proficiency. They contended that greater goal commitment, ability, and self-efficiency to perform the task related to the goal perceived importance of the goal and anticipated satisfaction if the goal is attained act as personal variables by which the effect of goal setting can be maximized. Other individual difference factors such as ethnicity, age, and sex were theorized to not moderate the effects of goal setting. As a whole, goal setting has shown to positively impact a lot of people from grade school ages to the elderly. As a group, we read a meta-analysis that covered the impact on goal setting and reward or positive feedback on physical activity. Throughout the article, they mentioned that feedback was very important to anyone who is trying to obtain the goal. When positive feedback is given, there is a positive outcome that comes through in the future. A number of studies within the field of behavioral medicine have pointed out to the benefits of goal setting and fostering physical activity behavior. Positive relationships derived from goal setting interventions have been found within multiple settings such as primary care centers, grade school classrooms, workplaces, and faith-based organizations. Overall, throughout the study, they found that reinforcement, positive relationships, and positive feedback is a good way to help motivate others to achieve a goal. Goal setting is everywhere, even in nursing homes or assisted living. When the caregiver is working with the elder, they should remember the three things that will push them to reach their goals: positive relationships, positive reinforcement, and positive feedback.
Collaborative Goal Setting. The next article that we researched is called Functional Goals and Predictors of Their Attainment. The purpose of the article was to measure the outcome of attainment for low-income, community-dwelling, older adults when paired with an occupational therapist. In other words, to study the factors that affect whether a goal is attained or not when done with assistance. In the study, there were 226 older adults all living in a community and suffered from some type of disability. With the help of an occupational therapist, they made 3 or more goals. The most common goal was transferring or moving. 160 of the participants had that as one of their goals. The next most common goal was changing or maintaining body position. 156 participants set that as their goal. The third most common goal was stair climbing. Only 95 participants had that as their goal. With the help of a therapist, 535 goals the older adults had set were attained. Stair climbing was the highest attained goal, next to moving and self-care. In conclusion, it was found that goal attainment was not associated with age, sex, education, depressive symptoms, function, or health-related quality of life. Goals were less likely attained when the participant had severe pain. Participants without severe pain were more likely to attain their goal. Additionally, the occupational therapist rated the participants' readiness level on a 4-point scale. When the readiness increased by 1 point, the goal attainment increased by 62%. All in all, when an occupational therapist was paired with a low-income older adult that lived in a community, collaborative goal setting was most effective when the older adults were prepared and willing to implement new strategies. This shows that one-on-one home-based goal setting is practical for low-income older adults with a disability.
Individual progress towards self-selected goals. Goal setting was first identified as a strategy for behavior change in theory and has since become a central component of physical activity counseling and rehabilitation programs, according to Locke and Shaw, Sari, and Latham. Goal setting is a way to self-monitor that increase in activity behavior by using motivation. According to a study done by Schilt, Horowitz, and Townsend, very few studies are done to examine goal setting in older adults. So the purpose of this study was to examine what happened to goals over the course of physical activity counseling trials in older adults. To start, they had older adults make one health-related goal and one walking goal for their participation in this study. They also rated themselves as to where they were in correlation with said goal. They would again rate themselves at 6 months into the study and again at the year marker. The participants were all 70 years of age or older and had no chronic health issues and could walk without assistance. In many older adult settings, personal goals are more important than the goal set by a researcher team or doctor. So in order to make sure that older adults were following suit, they developed the PFG, which is the Personal Functional Goal Interview Protocol. It was designed to assess and track personal functional goals in older adults in the context of exercise intervention. It was also designed to follow the social cognitive theory, which was developed by Bandura in 1997. It deals with cognitive, emotional aspects and behavior for understanding behavioral change. What that means is that the theory explains how people acquire and maintain certain behavioral patterns while providing the basis for intervention strategies. Evaluating the behavior change depends on factors of environment, people, behavior, and in order to implement and evaluate programs. The older adults in the study were asked to walk for 30 minutes or more 5 days a week and also do 15 minutes of leg exercises that increase strength training on 3 days a week. To offer encouragement, the older adults were called 3 times in the first 2 months and once from then on out. The counselor who called in to check on progress used social cognitive theory to make sure that the client had a supportive environment in how they were progressing. The goals were assessed by interview using the open-ended questions. The importance was to create a link between personal goals as well as the objectives set by the study. The participants were allowed to set their own goals without any guidance. Many of the responses were to get in shape so I can take care of myself and be able to walk with my wife. They were presented a picture of a ladder and saying the top rung was best shape and bottom rung was in bad physical shape. Where would you say you are? So the values recorded would represent perceived status related to self-selected goals. After 6 months, they asked them again to see how they had perceived their health and if they were achieving their own goals as well as at the year point. The results were that the PAC group and control group had significant and positive health-related goal status and walking goal status, as well as the intervention that incorporated social cognitive principles like self-monitoring, goal setting, and reinforcement. If older adults have a positive outlook on exercise and intervention, it will have a positive effect on the behavior of the older adults. Increasing the desire to exercise and stick to the intervention, they did see higher changes in those who were young old versus those who were old in age, which could be because of the amount of time of exercises and their background.
Setting goals for a client is something that most of us will be required to do in the near future as caregivers. Caregivers can come in all different forms dependent on what type of care the client needs. Some of those types are family members, friends, neighbors, nurses, CNAs, physical therapists, occupational therapists, speech therapists, and rec therapists. This case study article looked at goal setting with caregivers of adults in the community. The purpose of this study was to examine how goal setting is used with caregivers of community residing adults, and the effects of goal setting practices in improving outcomes. A total of 17 studies were included in this case, 10 randomized trials, 5 quantitative studies, and 2 descriptive studies which incorporated qualitative methods. This study looked at how a caregiver would set a goal for a client, and then how that same client would choose goals themselves. The evidence from this study suggested that although some intervention trials illustrate the usefulness of collaborative goal setting in contributing to improved outcomes. When a client feels more involved in their therapy process, they will get the most out of the modalities being used. This is oftentimes referred to as client-centered care. Outcomes of clients can be more successful if a client has a good support system, are intrinsically motivated, and are able-bodied to participate in implemented activities assigned for therapy and many other factors. If a client does not have these characteristics, then that client may have a more difficult time accomplishing his or her goals and outcomes. This does not mean that a client will not accomplish these goals, but it may just take them longer than the client who has those characteristics. If a nursing home facility has a recreational therapist, then the therapist will assess the client based on a holistic approach and assign them to a program that best suits their needs. The rec therapist will assess the client based on strengths and limitations in physical, social, emotional, cognitive, spiritual, and leisure domains.
For our community event, we created Yoga in the Park, Drop and Give Me Zen. The goal of this event is to improve listening skills, enhance focus, concentration, comprehension, and memory, improve posture, motor skills, and balance, improve confidence, self-esteem, reduce anxiety and tension, improve mind-body awareness and connection with self-acceptance, and express feelings in an appropriate manner, increase healthy responses to stress, develop relaxation techniques, and to increase physical activity and well-being. Our advertisements will be flyers, word of mouth, newspaper ads, and a radio ad.
For our nursing home event, we have created a DIY ice cream social. Goals of this program are hand-eye coordination, arm and hand strengthening, reminiscence, communication, critical thinking, and team building skills. These goals are established due to the overall average limitations that nursing home residents have based on previous assessment. Family members of residents are encouraged to attend this program with their loved ones. For advertisement of this program, we will post flyers around town and send individually to each resident. Word of mouth, place it on the event calendar, and a radio advertisement.
In the future, I plan to become a child life specialist. I will work with younger kids who are going through a tough time in a hospital setting. I will use goal setting with the kiddos that I am working with almost every day. We will make goals to maybe move a little more one day, or make a goal to smile more another day. I can make personal goals as well, such as getting a smile out of a child that is having a tough day, or create a craft that will get multiple kids interested.
For my future career, I plan to be a cardiac rehabilitation therapist. In this field of work, goal setting is essential. This career involves types of rehabilitation that helps reduce cardiac risk factors for patients that have suffered from a heart attack or a stroke. Long-term goals and short-term goals are needed to create exercise plans to help the patient return to normal life and reduce cardiac risk factors. I believe that goal setting will give patients an idea of where they are in the rehab and where they will be. Additionally, it will help with motivation and scheduling of exercise plans.
As an occupational therapist, goal setting is an important part of a client's therapeutic process for clients' individualized programs. During the first couple of sessions, an occupational therapist will look over previous assessments, medical records, and discussion with the client to gain a better understanding on the goals of the client. As an occupational therapist, I will work with all different age cohorts, so goal setting will look different for each group.
As a recreational therapist, I will work individually by assessing each client and help them make goals based on what they like to do and help them overcome any ailments. The goals will be holistic and aim to achieve overall health benefits. My focus is geriatrics, so learning about goals and objectives for older adults was beneficial.